Hello everyone, now let us discuss about 2023 ICD 10cm coding guidelines for chapter 4, which deals with endocrine, nutrition and metabolic diseases. In the current session, there are guidelines regarding the coding of diabetes mellitus. And in the diabetes mellitus, we will be covering these topics. First one is type of diabetes mellitus. The next is about type of diabetes mellitus. What should be coded when type of diabetes mellitus is not documented. The next is the coding scenarios for diabetes mellitus and the use of insulin and oral hypoglycemic drugs. In the current year, there has been an update in this session. The next is diabetes mellitus in pregnancy and gestation diabetes. Next is complications due to insulin pump malfunction. And finally, secondary diabetes mellitus. First, coming to diabetes mellitus. The diabetes mellitus codes are combination codes that include the type of diabetes mellitus, body system affected, and the complications affecting the body system. They are combination codes in the diabetes mellitus section. They should be sequenced based upon the reason for a particular encounter and assign as many codes from category E8 to E13 as needed. You can assign as many codes as possible from the categories E08 to E13 as needed to identify all the associated conditions that the patient has. Now, coming to types of DM codes, E08 series, it deals with diabetes mellitus due to underlying condition. Whenever coding E08, first you need to code the underlying condition as PDX. After that, you need to give diabetes mellitus due to underlying condition code, which come under the category E08. The next is E09, which deals with drug or chemical induced diabetes mellitus. And the next is E10, which deals with type 1 diabetes mellitus. Next is E11, which deals with type 2 diabetes mellitus. And finally E13, which deals with other specified diabetes mellitus. Now coming to type 1 diabetes mellitus. So when should we assign type 1 diabetes mellitus? That is the code from the category E10. Whenever the physician documents as brittle diabetes mellitus due to autoimmune process, diabetes mellitus due to immune mediated pancreatic islet beta cell destruction, idiopathic diabetes mellitus, juvenile onset diabetes mellitus, and ketosis prone diabetes mellitus. In all the above cases, we need to code type 1 diabetes mellitus, that is from the category E10. One more important point regarding the E10 coding is we should not assign drug control codes, that is long-term drug use of insulin, oral hypoglycemics and injectable hypoglycemics for type 1 diabetes mellitus. Coming to the coding of diabetes mellitus, whenever we code diabetes mellitus, age of the patient is not the sole determining factor. Though most type 1 diabetes develop the condition before reaching puberty, age is not the sole determining factor. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes mellitus. Coming to the, let us see an example. A 45-year-old is diagnosed with type 1 diabetes mellitus. And then the second example is patient is diagnosed with juvenile diabetes mellitus. In both these cases, in the first case, though type 1 diabetes mellitus develops before reaching puberty, even though the patient is 45 years old, that patient is diagnosed with type 1 diabetes mellitus. So you can see that age is not the sole determining factor. And in both the examples, the appropriate answer is E10.9, which is nothing but type 1 diabetes mellitus NOS. For the juvenile diabetes mellitus and also for a 45-year-old patient who is diagnosed with type 1 diabetes mellitus, we are assigning the same code, that is E10.9. Now coming to the scenario where type of diabetes mellitus is not documented. If the type of diabetes mellitus is not documented in the medical record, by default you need to assign E11 series, that is type 2 diabetes mellitus. This is a ground rule. Let us see an example. Type of diabetes mellitus is not documented. Office visit lists diabetic retinopathy with macular edema and hypertension on problems list. Patient problem list. PT means patient problem list. So here the type of diabetes mellitus is not documented. So whenever the type of diabetes mellitus is not documented, you need to assign or assume that it is type 2 diabetes mellitus. So the appropriate codes are E11.311, which is nothing but type 2 diabetes mellitus with unspecified diabetic retinopathy with the macular edema. And additionally, patient has hypertension also. For that you need to assign I10, which is nothing but benign essential hypertension. Now coming to the next scenario, diabetes mellitus with the use of oral hypoglycemic or insulin. So first case is when the type of diabetes mellitus is not documented, you need to assign E11 category. One more important point is if the type of the diabetes mellitus is not documented but it is indicated that patient is using insulin. In the medical record, the type of the diabetes mellitus is not documented and it is indicated that patient is using insulin. Even in that case also you need to code type 2 diabetes mellitus by default. So whenever the type is not documented in that case, and secondly whenever the patient is using insulin and the type is not documented. In both the cases by default you need to assign E11 category. And whenever we are assigning E11, E8, E9 and E13 in all these categories except E10, you need to use additional codes from the category Z79 to indicate the drug use for the control of diabetes mellitus. So whenever we are assigning the categories from type 2, E8, E9 and E13, in all these cases you need to assign these additional codes, that is Z79.4 for long-term current use of insulin, Z79.84 for long-term and current use of oral hypoglycemic drugs, and this year there is a new addition Z79.85 for other long-term drug therapy for injectable anti-diabetic drug other than insulin. For the use of injectable anti-diabetic drug other than insulin, you need to assign Z79.85. This is a new addition, that is new guideline for 2023. And one more important point is code Z79.4, that is long-term current use of insulin should not be assigned if insulin is given temporarily to bring a type 2 patient blood sugar under control. He is not using it regularly, but whenever insulin is given temporarily to bring down the blood sugar level, in those cases you should not assign long-term use. So as the name indicates, Z79.4 should only be used if there is long-term use, that is chronic use of the drug. Now let us see scenarios. If the patient uses both insulin and oral hypoglycemic drugs, you need to code both insulin and oral hypoglycemic drugs. That is addition to the type of diabetes, you need to assign Z79.4 and Z79.84. And if the patient uses both insulin and injectable non-insulin diabetic drug, for example Ozempic, in that case you need to code both Z79.4 and Z79.85. This is a new addition. And the next is if the patient uses both oral hypoglycemics and injectable non-insulin diabetic drug. For that you need to assign additional codes Z79.84 and Z79.85. And finally, if the patient uses all three, that is insulin, oral hypoglycemic drugs and also injectable non-insulin diabetic drug, in that case in addition to the type of diabetes, you need to code all three codes, that is Z79.4, Z79.84 and Z79.85. Now let us see examples. Patient with diabetes mellitus managed by metformin and lantus. Here metformin is oral anti-diabetic drug, whereas lantus is a brand of insulin. So here the type of diabetes mellitus is not documented and it is indicated that patient is using insulin. So by default you need to use type 2 diabetes mellitus. The appropriate codes are E11.9, which is nothing but type 2 diabetes mellitus without complications, followed by Z79.4, which is indicated for long-term current use of insulin. This is given for lantus, and followed by Z79.84, long-term current use of oral anti-diabetic drugs, which is given for metformin. Coming to next example, patient with insulin-dependent diabetes mellitus. This is a synonym for type 2 diabetes mellitus. Patient with insulin-dependent diabetes mellitus on Ozempic, Lantus and metformin. Here, Ozempic is the injectable non-insulin anti-diabetic drug. So, for insulin-dependent diabetes mellitus, you need to indicate type 2 diabetes mellitus E11.9, type 2 diabetes mellitus without complications, followed by Z79.4 to indicate long-term current use of insulin, followed by Z79.84 to indicate long-term current use of oral anti-diabetic drug. Long-term and current, that is patient must be using, and he should be using since 6 months, more than 6 months, that is indicated for long term. And finally Z79.85, which is a new addition, long term current use of injectable non-insulin anti-diabetic drug. Now coming to exceptions, code Z79.4 should not be assigned if insulin is given temporarily, that we have discussed earlier, to bring down type 2 patients' blood sugar under control during an encounter. Let us see an example. Type 2 diabetes without complications, normally only on oral metformin, is given insulin for 3 days. Here, usually he is on oral metformin, but insulin is given for 3 days to maintain glucose control while in the hospital recovering from surgery. In this case, insulin is given temporarily to bring down the sugar levels. So you should not, though patient is given insulin, you should not use Z79.4. Appropriate codes for this scenario are E11.9 to indicate type 2 diabetes without complications, followed by Z79.84 to indicate long-term current use of oral hypoglycemic drugs. Let us see one more example. Type 2 diabetes mellitus with diabetic polyneuropathy on insulin. Here he is on long-term use of insulin. So the appropriate codes are E11.42 to indicate type 2 diabetes mellitus with diabetic polyneuropathy, followed by Z79.4, long-term current use of insulin. By this it is clear that when should we use Z79.4? Whenever insulin is given temporarily to bring down blood sugar level, in that case we should not quote Z79.4. Now coming to diabetes mellitus in pregnancy, gestation and gestational diabetes mellitus. Diabetes mellitus is a significant complicating factor in pregnancy. Pregnant women who are diabetic should be assigned a code from the category O24. That is diabetes mellitus in pregnancy, childbirth and puerperium first, followed by appropriate diabetes codes. So whenever one ground rule is chapter 15 codes, that is the old codes, they take the first priority irrespective of any other condition. So whenever pregnancy related codes are there, they are given first priority and they are coded as PDX. Even in diabetes also, if the pregnant women who are diabetic should be assigned a code from the category O24, followed by appropriate diabetes codes. Here PDX should be O24, code from the series O24, followed by E8 to E13. Whatever respective type of diabetes it is, you can code that thing. Now in pregnancy, DM in pregnancy means either DM should be pre-existing or it occurs during the pregnancy, or if there is any abnormal glucose tolerance test. There are three scenarios for diabetes mellitus in pregnancy. First case is patient is a diabetic patient and if she is pregnant, in that case it is considered as pre-existing diabetes mellitus. For pre-existing diabetes mellitus, the codes are O24 dot. Here the fourth character 0, 1 and 3. We will discuss in detail in the further session what are the specific codes. So as of now the category O24.0, 1 or 3 should be given for pre-existing. And for gestational diabetes means if the previously patient is not diabetic, but diabetes mellitus, when it develops during the pregnancy, it is called as gestational diabetes mellitus. So the code range for gestational diabetes mellitus, they come from O24.4. This is further expandable. Here the fourth digit is 4. Indicates gestational diabetes mellitus. And finally, abnormal glucose tolerance test. We know that GTT, which is nothing but glucose tolerance test, is performed during the pregnancy over trimesters, couple of times. So whenever there is abnormal GTT, there is a specific code to indicate that. That is O99.81. O99.81, which is nothing but abnormal glucose complicating pregnancy, childbirth, and purpurium. This code should be given for abnormal GTT test. Now let us see the table here. We know that for DM in pregnancy, the categories come under O24. So O24.0 is given for pre-existing type 1 diabetes mellitus. If the fourth character is 0, it indicates that type 1, pre-existing type 1 diabetes mellitus. So O20 and fifth character indicates whether it is pregnancy, childbirth or purpurium. The fourth character indicates type of diabetes. And the fifth character, it indicates whether it is in the pregnancy or during the childbirth or purpurium. It is given, fifth character can be 1, 2 or 3. So O24.0 indicates it is pre-existing type 1 diabetes mellitus. And fifth character 1 indicates for pregnancy, 2 is given for childbirth and 3 is given for purpurium. So O24.03 indicates type 1 diabetes mellitus in purpurium, whereas O24.02 indicates pre-existing type 1 diabetes mellitus in childbirth. And O24.01 indicates pre-existing type 1 diabetes mellitus in pregnancy. It is further classified with the sixth character. The sixth character can be 1, 2, 3 and 9 for pre-existing cases. And for gestational diabetes mellitus, the sixth character can be 0, 4, 5 and 9. We will discuss this. So, for pre-existing diabetes mellitus, the sixth character can be 1, 2, 3 and 9. Whenever the sixth character is 1, it indicates first trimester, which is less than 14 weeks. The first trimester means less than 14 weeks. If the sixth character is 2, it indicates second trimester, that is 14 weeks 0 days to 28 weeks. And if the sixth character is 3, it indicates third trimester from 28 weeks 0 days up till delivery. And if the sixth character 9, it indicates unspecified trimester. So O24.0 indicates pre-existing type 1 diabetes mellitus, 1 indicates in pregnancy, first trimester. So O24.011, this is a complete code. It indicates pre-existing type 1 diabetes mellitus in pregnancy, first trimester. So this is applicable for all types. O24.1 indicates pre-existing type 2 diabetes mellitus. And here also the fifth character is same as type 1. That is 1 indicates pregnancy, 2 indicates childbirth and 3 indicates purpurium. So for O24.11 indicates pre-existing type 2 diabetes mellitus in pregnancy. Even the sixth character classification is same. 0, 1 indicates for first trimester, 2 indicates for second trimester, 3 indicates for third trimester, and 9 indicates for unspecified trimester. And finally, O24.3. The fourth character 3 indicates pre-existing diabetes mellitus, unspecified type. It is not indicated whether it is type 1 or type 2. For that, fourth character 3 should be given. And the fifth character 1, 2 and 3 1 indicates pregnancy, 2 indicates childbirth, and 3 indicates purpura. And the sixth character 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester, and 9 indicates unspecified trimester. Finally, coming to gestational diabetes, O24.4. The fourth character 4 indicates gestational diabetes mellitus. Gestational diabetes mellitus can be in pregnancy, childbirth, and purpura. So the fifth character is same, but there is difference in the sixth character. Sixth character is 0, 4, 5 and 9. We will discuss in the next slide regarding this. Next is O24.8 indicates other specified pre-existing, other specified diabetes mellitus. This is same as, that is fifth character classification is same, 1, 2 and 3. 1 indicates pregnancy, 2 indicates childbirth, and 3 indicates purpura. And sixth character is also same. 1 indicates first trimester, 2 indicates second trimester, 3 indicates third trimester, 9 indicates unspecified trimester. And similarly, O24.9 unspecified diabetes, whether it is pre-existing or gestation. Pregnant woman is suffering from diabetes, it is unspecified whether it is pre-existing or gestational. In those cases, you need to assign O24.9. Fifth character classification is same as type 1 and sixth character classification is same as type 2. And we will discuss in detail about gestational diabetes now. Coming to gestational diabetes, that is nothing but pregnancy-induced diabetes mellitus. Gestational or pregnancy-induced diabetes mellitus can occur during the second and third trimester only. For that reason, there is no specification regarding the trimester of the pregnancy in the women who are not diabetic prior to pregnancy. Gestational diabetes can cause complications in the pregnancy similar to those of pre-existing diabetes mellitus. It also puts the woman at greater risk of developing diabetes after the pregnancy, and the codes for gestational diabetes are in the subcategory O24.4, which is nothing but gestational diabetes. No other code from category O24. Diabetes in pregnancy, childbirth and purpura should be used along with the code O24. So these two are contraindicated. Either diabetes can be pre-existing or gestational. So whenever we are coding gestational diabetes, you should not code other code from the category O24. They should not be used along with the code O24.4. Now coming to the codes for gestational diabetes mellitus. Gestational diabetes mellitus in pregnancy, diet controlled. Though because it occurs only in the second and third trimester, there is no trimester specification. Whereas the DM, gestational diabetes mellitus, is further categorized based upon the control, whether it is diet controlled, insulin controlled or oral hypoglycemic controlled, etc. So for gestational diabetes in pregnancy, if it is diet controlled, the code is O24.410. Here the sixth character 0 indicates it is diet controlled. And the sixth character 4 indicates it is insulin controlled. And the sixth character 5 indicates it is oral hypoglycemic drugs controlled. The gestational diabetes in pregnancy controlled by oral hypoglycemic drugs. And sixth character 9 indicates unspecified controlled. So the codes under category O24.4 include diet control, insulin control, controlled by oral hypoglycemic drugs and unspecified control. If the patient with gestational diabetes mellitus is treated with both diet and insulin, only code for insulin control is required. So O24.414 should be given. And if the patient with gestational diabetes is treated with both diet and oral hypoglycemic medication, only the code for controlled by oral hypoglycemic drugs is required. So O24.415. One more important point is long-term use of drugs Z79.4 and Z79.84 should not be assigned with codes from subcategory O24.4. Long-term use of insulin and long-term use of oral hypoglycemic drugs should not be coded with gestational diabetes O24.4. Now coming for complications due to insulin pump malfunction. The coding scenarios can be two types, either underdosing of insulin or overdosing of insulin. For underdose of insulin due to insulin pump failure, the PDX should be from the category T85.6. This code is further expandable, a mechanical complication, followed by T38.3x6. Underdosing of insulin. This is also further expandable, followed by additional codes for type of diabetes. And for overdosing of insulin due to insulin pump failure. For overdosing also, the PDX is from the category T85.6 only, a mechanical complication, followed by T38.3x1, which indicates poisoning by insulin accidental. This code is also further expandable, followed by additional codes for type of diabetes mellitus. Now let us see an example. A 24-year-old type 1 diabetes male treated in for hyperglycemia. Insulin pump found to be malfunctioning and underdosing. Here patient is suffering from hyperglycemia and patient has type 1 diabetes mellitus. Hyperglycemia occurred due to insulin pump underdosing. So the first PDX should be T85.614A. Breakdown mechanical of insulin pump initial encounter. A indicates initial encounter, followed by T38.3x6A. Underdosing of insulin and oral hypoglycemic drugs. Initial encounter. Here initial encounter is not typed. A indicates initial encounter. Followed by E11.65 type 1 diabetes with hyperglycemia. Now let us see one more example. A type 2 diabetic patient found down with diabetic coma, brought into ED and treated for hypoglycemia. Here hyperglycemia, here hypoglycemia. Insulin pump was found to be malfunctioning and overdosing. Here overdosing caused hypoglycemia. So the first code is same, T85.614A. Mechanical breakdown of insulin pump initial encounter. Because of overdosing, you need to code the poisoning code. T38.3x1A indicates poisoning by insulin or oral hypoglycemic drugs, accidental, which is nothing but unintentional. Followed by type of diabetes code E11.641, which indicates type 2 diabetes mellitus with hypoglycemia. Now finally coming to secondary diabetes mellitus. The codes under the category E08, diabetes mellitus due to underlying condition, E09, drug or chemical induced diabetes mellitus, and E13, other specified diabetes mellitus, identify complications or manifestations associated with secondary diabetes mellitus. And the secondary diabetes mellitus is always caused by, as the name indicates, it is secondary. Secondary diabetes mellitus is always caused by another condition or event. Condition can be cystic fibrosis, malignant neoplasm or of pancreas or pancreectomy. An event can be pancreectomy, adverse effect or poisoning. It can always be caused by another condition or event. Now coming to various codes of secondary diabetes mellitus, the first is E08, which is nothing but diabetes mellitus due to underlying conditions. So whenever coding E08, it should be given as SDX, not as PDX, because under it you can find code first underlying conditions such as either it can be congenital rubella, Cushing syndrome or cystic fibrosis or malignant neoplasm or malnutrition or pancreatitis or other diseases of pancreas. These conditions can cause secondary diabetes mellitus. Whenever diabetes mellitus is due to these underlying conditions, you need to code E08. Diabetes mellitus due to underlying condition. The next is E09, drug or chemical induced diabetes mellitus. Whenever coding this code, code first poisoning due to drug or toxin is if applicable, and also you need to code adverse effects before coding this. Next is E13, other specified diabetes mellitus. It identifies the complications and manifestations associated with secondary diabetes mellitus. E13 should be given when DM due to genetic defects of beta cell function or genetic defects in insulin action or post-pancreatectomy. So whenever physician documents post-pancreatectomy of diabetes mellitus, you need to code E13. And whenever he documents post-procedural DM, for post-pancreatectomy DM, post-procedural DM and secondary diabetes mellitus NEC. In all these cases, you need to assign code E13, code from the category E13. And in all these cases, you need to use additional code for drug control for E08, E09 and E13. Now coming to secondary diabetes mellitus, secondary diabetes mellitus and the use of insulin or oral hypoglycemic drugs. An additional code from the category Z79.4 to indicate long-term use of insulin or Z79.84 to indicate long-term use of oral hypoglycemic drugs should be given. And also Z79.85 to indicate oral long-term use of non-insulin injectable anti-diabetic drug. Assigning and sequencing of secondary diabetes codes and its causes. Under diabetes mellitus, there are two subcategories for guidelines. First is use of drugs. For that, you need to use the additional code from the category Z79.4 and Z79.84 and 85. And second case is assigning and sequencing of secondary diabetes codes and its causes. So whenever post-procedural hyperinsulinemia is given, first you need to code E89.1 followed by E13 and then additionally Z90.41 to indicate any acquired absence of pancreas. We will discuss an example, then you will understand much better. Now for post-pancreatectomy diabetes mellitus, that is lack of insulin due to surgical removal of all or parts of pancreas, assign code E89.1 post-procedural hyperinsulinemia first, followed by code from the category E13 and additionally code from the category Z90.41 to indicate acquired absence of pancreas. Let us see an example. Patient with newly diagnosed diabetes after surgical removal of part of pancreas. For that, first period should be E89.1 post-procedural hypoinsulinemia, followed by E13.9 other specified diabetes mellitus without complications, followed by Z90.411 acquired absence of pancreas. Now coming to secondary diabetes due to drugs. Secondary diabetes may be caused by adverse effect of correctly administered drug or poisoning or sequel of poisoning. If diabetes is caused by an adverse effect of drug, then the diabetic condition is coded first. If diabetes is caused by adverse effect of drug, diabetic condition should be coded first, and whenever if there are poisoning code should be coded first. So let us see an example. Initial encounter for corticosteroid induced diabetes mellitus. Here, diabetes mellitus is caused by adverse effect of drug. So diabetic condition is coded first. So first period should be E09.9 drugs or chemical induced diabetes mellitus without complication, followed by T38.0x58 adverse effect of glucocorticoids and synthetic analogs. Initial encounter. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.